Hi folks, I hope everyone is keeping well, and I'm out of the ENT clinic today, ear, nose and throat, after having had a laryngoscopy, and I thought it might be useful to shed some light on that particular examination, and also just kind of that intersection with that department from a patient perspective, just to kind of share a little bit more about that, particularly useful perhaps for those that have not had any kind of interface with the clinical world in regards to their voice, maybe haven't been on a kind of vocal health pathway, or yeah, just that is unfamiliar territory, new territory. So yeah, I thought it might be interesting just to share a little bit about that. This is the second time I've had this examination, laryngoscopy before, and it's not the most pleasant. It does involve a long instrument being inserted up your nasal passageway and down the back of the throat, so that you are able to get a good look at the larynx and see everything in action, vocal folds and all. So yeah, the laryngoscope is flexible fiber optic cable with lights, camera, and the possibility of actually taking video footage of that as well. So that was today's adventure, and I think at the best of times it's not a particularly comfortable experience for those of you that remember doing the nasal swabs during COVID, and the kind of prompts in those kits to you know, insert your swab until you kind of felt a bit of resistance. We are going past and through that when we have a laryngoscopy. So yeah, it's a little uncomfortable. And apparently I have very narrow nasal passages, so I did find it quite eye-watering this afternoon, but thankfully everything there is looking good and clear and healthy, which is a real relief for me. But yes, this process, kind of going through my general practitioner, and that referral was felt like that was needed. So that's kind of how this has come about. But I know that the first time that I had that examination done, there was quite a lot of anxiety there, and build up towards that appointment, because it was something that was new and unfamiliar, and at the end of the day it is invasive as well. So if you are not from a kind of clinical perspective, there's always a kind of dynamic shift of going into a clinical environment, and the kind of the structures that are there, the formality of that. Certainly if there is any underlying anxiety or worry that you have before going into an appointment or an assessment of any kind, you know, additionally you're going into an environment where everything has a certain process and way of being. So yeah, you're also meeting that kind of energy shift. So I think it's good to be aware of what your kind of temperament is, and what your personal strategies are for kind of going into environments like that, and also just the kind of the management of your own yeah, energy levels in the build up to attending an appointment, and also yeah, what additional things can you do to support yourself to ensure that you feel as comfortable as you can. Also, that you feel able to speak for yourself and advocate for yourself, and articulate and express to the practitioner or clinician, what your concerns are. And yeah, that's quite a big process in itself. And I think to add into that communication and potentials there for challenges with that, or if there is trauma history there, it adds a degree of complexity in terms of how you actually navigate a space like that, and how you hold yourself in that space, and yeah, how you express your needs, and ensure that you feel seen and heard, and also, yeah, keeping yourself responsive to what can and often be quite a stimulating environment, going into potentially a department within a busy hospital. These are all things to consider, just to bear in mind in terms of how you might prepare yourself for going to an appointment. And yeah, also, I think it's pertinent to highlight BAPAM, the British Association for Performing Arts Medicine, because if you are a professional voice user, performer, that is another pathway to go through, and to be able to attend one of their clinics for assessment. And that kind of starts off a process with referrals, so they can draw up letters which can go to your GP, also then recommendations for ENT, if that is indeed the appropriate way to go. So many performers will already be aware of that support, but not I don't think BAPAM get enough of a cheerlead, so I just want to mention them as well, because that I have previously gone down that route way for ENT referral, and yes, that was for a different occasion, but I know at that point in time, certainly I was under a lot of stress, and really kind of feeling quite overwhelmed and not sure what was going on personally for my vocal health. And they were incredibly efficient, great with communication, and that was a really helpful kind of intermediary intersection between me raising a concern and then actually going to an appointment to have an examination. So they have a whole host of practitioners that are registered on their database, so definitely check them out. And connected into that is the Music Minds Matter scheme, because I think often when there is a kind of health concern going on, emotionally, psychologically, that can be really a vulnerable time for us, and sometimes there are complexities there with stress and anxiety and kind of other factors that kind of work together to create a bit of a melting pot of challenges. So it's really useful to know that there are avenues for mental health support as well through the Music Minds Matter scheme. So that's all worth noting, and disseminating that information for other performing arts practitioners. But yeah, otherwise, going through your GP, if there are any concerns there, if there are any issues that are occurring with the voice that are kind of affecting you beyond a few weeks, that is your kind of logical pathway. But yes, I just thought it would be useful to kind of highlight some of those things, and having kind of been through the process, having an insight into kind of all the different stages that are involved with that. And yeah, it's a strange world from the outset if you don't have the awareness of the different stages of that process. So yeah, I would say also BAPAM's website is a really useful place to get more information about that. Even if you don't consider yourself to be a performer, it is definitely a good shout to have a look there, because it's kind of a central space where there's lots of helpful links there. So yeah, I'm gonna leave it there. My nose still feels a bit weird, and yeah, it's given me the heebies just thinking about it. But anyway, it's all good. Everything is tip top, and yeah, feeling relieved about that. So on that note, I am wishing everyone a healthy festive period, and well wishes into the new year as well, wherever you are, however you celebrate. Yeah, really wishing everyone a gentle restorative time, and look forward to checking in with you in the new year, and connecting with you there, and sharing more evolutions and iterations of yeah, all the vocal offerings and personal development offerings that are coming your way. So until then, yeah, take care everyone, and yeah, take it easy.